What happened to this phone?
Oh,
This is tube gauze, right? Did I
Yep.
get that right? Okay.
We use tube gauze as a protective dressing, as well as to cover an open wound, of course.
You're going to move?
No, get a seat, Randy.
Don't show me either. Just my hand.
Okay, so you have your patient sitting with you. What you do is you hold the tube, the dressing at the base, you pull it up, you twist, you push it down. And you do it the opposite way.
She makes it seem so easy.
I know.
When you get to the end, then we have to cut. A lot of these I don't pass because they have what, Randy?
A nipple.
They have a nipple on the end. That's when you've twisted too much. And a lot of them have a foreskin,
Oh yeah, that.
where the underneath of the dressing is showing through the twist. In other words, you didn't twist enough. When you get down here, you have to tie one. So one knot, which is just one through, then you put it together to make two knots here. You with me?
Yes.
This has to go to the wrist. Then we go around the wrist. I slide through this side. I slide through this side. And now we're going to do 3 knots. 1, 2, 3. Then you cut your dressing.
Someone needs to go turn off their phone.
And then this is, I should not be able to pull it off of your finger, all right, without a lot of yanking. But a lot of times what happens is you guys don't cut down here far enough, so you have all of this extra stuff up here, and it will, so that it sits off of the finger. If it sits off of the finger, then it's not helping the patient with the wound or the protection for that wound. Maybe there's a large laceration on a joint. This protects that finger from the joint. This is how you put on a tube gauze. They're supposed to last at least 2 days. All right? Then a patient will come back. So when I see you to sign you off, or Randy sees you to sign it off, number 1, she's going to pull the end. Number 2, she's going to feel for a nipple, or she will feel for the foreskin. You'll see a little round. Let me see if I can do one so that I can show you what you don't do. I have a hard time doing it wrong because I've been doing it for many years, so... To get this back on here, we usually will, if it's going to go. Hang on. What was clicking?
No, I just read it. Just like a condom.
All right. Let me see if I can do it wrong. All right, what a lot of you do is I've seen them, you will twist it like this on the finger. What that does is it tightens the dressing on the wound. See, you see how it kind of goes to the, when you twist it here?
You can feel it tight.
You can feel it tight on the finger. We don't want that. So you twist at the end. But if you twist too much,
Then you get that. I can feel it already.
Yeah. What you're going to get is,
A little ball.
let me get this, is this nipple here. All right? We don't want this. It's uncomfortable for the patient. So we only need it twisted once. That's why I say you twist one way, then the other. However, let me get the first one done. If you don't twist enough, what's going to happen is you're going to end up with this ridge where I can pull it down. Okay?
An opening.
I call that a condom. It's when it's not sealed enough at the end that it will cause problems.
Pregnancy.
It's foreskin.
This is a foreskin, excuse me. All right, so those are the two mistakes that I don't need for you to make. My nose is running.
What's the size of the gauze again?
1 inch.
And this
Remember
is
I
for
told
what
you?
kind of wrap?
This is a finger wrap.
Finger wrap.
And your finger wrap. Finger wrap. What we do is if the finger is injured, we don't need the padding on it. We just need a wound covered. If they've got tube gauze, you'll probably use that. All right. You ready? Ready? You start one end. You go down. You go back over here. When you get to here, you turn it. You go around the finger at the base, not too tight. Now we're going to come up the finger at an angle, right? When we get to the top, we're going to do figure 8. Got it? Down at the opposite angle. Back up. We're going to do the other side.
Of the figure 8.
Figure 8. All right? When you get to the base, we're going to go down to the wrist, around once, and back up. We are going to do the same thing, up at an angle. We are going to go over and down. Up at the different angle, we are going to go over and down.
So one wrap finishes the whole entire.
Yeah.
Okay.
I could have done a bit more, but I would cut it here. What I need from you guys when I do this is that I have a hard time getting the tip. You see how hard I'm pulling this, Alicia?
Yeah.
Tell them how hard I'm pulling it.
Yeah.
I need to be able to pull really hard before I get it off. If I just do this, it's no good. All right?
Serving the purpose.
Do you understand? So this has to be really on there good. However, put your finger up. Show them. There is no, all of them. There is no blood loss or redness of the finger because my bandage was on too tight. If I see that the circulation, in other words, when I take it off and this finger goes white and then immediately red, you've cut off circulation. That means that patient would have this for 2 days and probably lose her finger because she'll end up with gangrene. So dressings are very important. A lot of patients come in with wounds. So those are the things that you have to take care of. And that is a finger dressing.
Thank you.
Do for a wrist dressing. All right. This is an ace wrap for a wrist. It's a 3-inch ace wrap. All right. What I do is for the thumb. Stops it from slipping. Roll has to be up, not down. All right, always up. You go around the wrist. When you come back down here, you have to fold. Okay? You go up, and then down. Up, and then down. This has to be on the actual bandage. All right? This is an ace wrap. No knuckles covered. Has to be through here. This actually should have been down a little bit further. But I should be able to get 2 fingers underneath. We never stretch an ace wrap. It is always put on. I have no problems getting anything under here. If it is too tight, I'll see if I can do it so it's a little tight.
It hurts. It feels like it's cutting off your circulation when it's too tight.
Yeah. Hang on. These are Miss Dennis's hands. Okay, so if I was putting this on and I was doing it tight, I would stretch. This is what I don't want you to do. Sure, it feels good for a time. I don't know if I can even do it so it's gonna be
I
tight.
can feel it tight.
It's tight.
Tighter than it was.
Okay. I don't know whether it will do it. I'm
it's tight.
so used to doing it loose, it's hard. But you see how I'm having a hard time? Oh, it is tight, yeah.
Mm-hmm.
All right, I'll show you. Look, if you keep the camera on her arm, you will see the indentation, and it's going red, but the indentation of the ace wrap. So we don't want to see any indentations. I don't want to see, I should be able to get 2 fingers down with no problem.
So it's not tug.
It shouldn't be tight. An ace wrap is elastic in case the wrist swells. It will have some place to go. It's a support bandage. We put the bandage on to support the injured joint. If that joint swells, then it's got room to swell because it's an elastic bandage. Your bandage is up.
And this is a what?
Elbow. Let me
Elbow.
have somebody else.
Elbow wrap.
Yeah. All the way up, please. Thank you. What this does is the bend in the elbow, we go at an angle. Yeah?
Yes.
You go below, and then we go way up. And then we come in and we fill where we were. Yeah? What this has to do is go, bend your arm, above her elbow, but below the skin. Yeah?
Okay.
And again, I should be able to get 2 fingers in with no problem.
And when do you typically need an elbow wrap?
Usually if there's an elbow strain, somebody has maybe lifted something, dislocated their elbow, you may put something on to support it and then give her a sling. It's a supporting system.
So the support mainly is on the top of the elbow?
It's for, we,
Because
look,
I noticed you only wrap once.
right, but it is just to wrap around. There has to be this much above, because if I do more down here, it's going to fall off of her arm. Because her arm is wider here
Right.
than it is here.
Okay.
So we always start from the narrow to go up to the wider, never from the wider down. All right? So elbow wrap, wrist wrap, tube gauze, I do a knee wrap. The knee wrap is the same as this, except you will use the 6-inch. This is a 4-inch. 3-inch for the wrist, 4-inch for the elbow.
How are you measuring that?
Your thumb is about 1 inch.
Okay.
I just do it to approximate. This is a 4. So these are your wraps that I want you to at least start on, okay? I've given you 1, 2, 3 for you to start on. Maybe I should show you the other one. Okay, I'm finished. This is an ace wrap at the knee. That we have the knee in a flexed area. Usually have the patient put the toe on the stool so that we can keep it still. We apply the ace wrap across the knee, underneath, then we go up higher on the leg. We come down and cover our area so that we end up with the ace wrap being done up above the knee and the joint. This is an ace wrap. Start at an angle over the ankle, go around the foot and up over the ankle, down around the foot, up over the ankle, figure 8, down over the foot, up over the ankle, down over the foot, and do it up either on top or over on the side. We don't need it anywhere near the bottom because if she's going to put any weight on it, it's going to affect her. This is at a right angle. I should be able, excuse me, I hope you're not ticklish. Should be able to get 2 fingers under with no problem. You roll an ace wrap, you don't stretch it. And we're done.